Emergency medical responders save lives. Emergency responders are highly skilled professionals dedicated to their jobs, and they perform these jobs above and beyond the call of duty on a daily basis. Regardless of the obstacles, the problems, the long hours, they come through in emergencies. The general public doesn't think about the services these professionals provide. They know the services will be there when and if the need arises. Whether you're a police officer, fire professional, industrial first aid, or CPR trained person, emergency medical technician, correctional officer, or other emergency responder, you have a big responsibility that requires a lot of skill, training, expertise, and dedication to the job. Emergency responders save lives. In your job as emergency responders, there's a new threat to your own personal safety and health, and it's called blood-borne pathogens. Blood-borne pathogens have existed since medical treatment has been provided. However, in recent years, the threat of exposure to HIV, or the AIDS virus, through contact with human blood, has created alarm and concern for the health of those persons performing medical treatment. You can't tell a person has HIV or other blood-borne pathogen by looking at them. An accident victim needs help, and it's your job to provide the assistance needed, whether they're bleeding or not. Your job takes on a lot of responsibility, not only for the medical assistance, but for your own health and safety while providing these services. That's what this program is all about, protecting your health from blood-borne pathogens while you're performing these services. Let's begin with explaining blood-borne pathogens. AIDS is an infectious disease. It is contagious, but it cannot be spread in the same manner as a common cold or measles. It's contagious in the same way that sexually transmitted diseases such as syphilis and gonorrhea are contagious. It is clear that the AIDS virus is not transmitted by casual contact. The disease AIDS, or acquired immunodeficiency syndrome, is caused by the human immunodeficiency virus, or HIV. AIDS is a pattern of symptoms which together characterize a particular disease or disorder. AIDS is not a virus, and the words HIV and AIDS are not interchangeable. However, the general public uses these two words interchangeably, which is not medically correct. In the workplace, occupational exposure to HIV is a risk, although a relatively small risk. However, precautions must be taken to reduce even the smallest risk to occupational exposure to HIV and other blood-borne pathogens. Another serious disease or blood-borne occupational exposure that emergency responders face is HBV, or hepatitis B. Hepatitis B is perhaps the more common exposure. However, both HIV and HBV require specific precautions to prevent exposure. Hepatitis C is a blood-borne infection caused by an RNA virus, hepatitis C virus, HCV.
Hepatitis C is a virus that is passed similarly to hepatitis B. It's passed through blood contact, rarely through sexual contact, although it can be. And people that share needles and people who had blood transfusions before the early 1990s are at great risk for actually having hepatitis C. And it affects the liver by causing usually inflammation of the liver with chronic scarring of the liver. And people who have hepatitis C are at risk for developing cirrhosis after many, many years, usually 20 years after exposure.
This virus causes damage to the liver that may result in chronic infection and disease. HCV is unrelated to any of the other known hepatitis viruses, A, B, D, and E, and infection is identified by the detection of antibodies to the virus in the blood. Unlike many other infections, the presence of antibodies in the blood does not signify recovery. Over 85% of infected individuals fail to clear the virus spontaneously and develop chronic infections. Viruses can't be seen by the eye or even under a microscope. It takes an electron microscope to see them. Worldwide, some 170 million people are chronically infected with HCV, with almost 4 million of them in the United States. There are an estimated 3.9 million Americans affected with hepatitis C, of whom 2.7 million have chronic hepatitis C, 75% of which have no idea they're infected and capable of transmitting the disease to others. About 85% of infected adults will develop chronic or long-lasting hepatitis C infections. To put these numbers in perspective, That's more than 3 times those infected with HIV or the virus that causes AIDS. HIV is spread when blood or body fluids from an infected person enter the body of a person who is not infected. The Institute of Medicine classifies hepatitis C as an emerging infectious disease. Hepatitis C is serious for some persons, but not for others. Most persons who get hepatitis C carry the virus for the rest of their lives. Most of these persons have some liver damage, but many do not feel sick from the disease. Some persons with liver damage due to hepatitis C may develop cirrhosis or scarring of the liver and liver failure, which may take many years to develop. Certainly, there are other blood-borne pathogens. However, the precautions taken to prevent exposure to HIV and HBV are adequate to prevent exposure to all other blood-borne pathogens. Studies have shown that these viruses can be transmitted by blood and other body fluids, including semen, vaginal fluids, pregnancy fluid, brain and backbone fluids, joint and chest fluids, abdominal and heart fluids. There are personal methods of transmission, such as sex with an infected person, sharing needles with IV drug users, and other high-risk behavior. However, this program is directed at occupational exposures of blood-borne pathogens. OSHA, or the Occupational Safety and Health Administration, has published new rules and standards for the control of occupational exposures to blood-borne pathogens, which your employer must follow and implement. Written information such as an exposure control plan and other procedures is available for your review and use should you want more information about your employer's plan and procedures. A copy of the federal regulations pertaining to blood-borne pathogens is also available for your use. When we talk about occupational exposure to blood-borne pathogens, specifically HIV and HBV, the information generally applies to your normal routine duties, but contingency plans for an emergency or accident must be considered. Likely exposures are those persons working in hospitals, clinics, dental offices, and anyone reasonably anticipated coming in contact with blood and body fluids, such as emergency responders, which includes police, fire, ambulance drivers, emergency medical technicians, and those persons who are trained and assigned duties as first aid or CPR providers. In a manufacturing plant, an assembly worker would not be reasonably anticipated coming in contact with blood or body fluids unless that person was assigned the additional job as a first aid or CPR provider. Naturally, anyone who is exposed to blood or body fluids is at risk, so the information about blood-borne pathogens should be provided to everyone regardless of their exposures. The reason for this is when a person is injured, it's human nature to run to the rescue. An automobile accident victim needs help, and if no one is there to provide assistance, the first person on the scene wants to help. But without some knowledge about blood-borne pathogens, they could be at risk of exposure to HIV or HBV. Let's quickly review some of the elements of an exposure control plan. Again, this is a written plan designed to provide the necessary engineering controls, training, personal protective equipment to prevent exposures to blood-borne pathogens. First, each individual job that potentially could expose a person to blood-borne pathogens must be identified, and the job description and classification where these exposures may occur. The plan must set forth a schedule for implementing the OSHA standard and must specify the procedure for evaluation of the circumstances surrounding exposure incidents. Generally, if an exposure does occur, management must investigate the circumstances of the incident and develop additional procedures or precautions to take to prevent future incidents as much as possible. The plan must be updated at least annually, or more often if necessary to accommodate workplace changes. If you want to review this exposure control plan, contact your supervisor for more information. In addition to personal hygiene and safe work practices, additional means of prevention are through engineering controls. This means controlling or eliminating the hazards at their sources. Emergency responders may not have all the engineering controls that could be found in a hospital or emergency treatment center, such as autoclaves or sterilizing units. But there are other measures available to reduce exposures. Disinfectants kill bacteria through chemical means, so these engineering controls are available to most emergency situations. Waste containers for contaminated needles and other sharps are considered engineering controls. Perhaps the most important precautions that can be taken by emergency responders to reduce risks to blood-borne pathogens is personal hygiene. We addressed the fact that blood and certain body fluids can carry the HIV and HBV viruses, but other body fluids do not carry the viruses unless contaminated with blood. Universal precautions is a designation in the medical community that encourages treating all body fluids as potentially harmful and should be treated as containing blood-borne pathogens. In this context, emergency responders should treat all blood and all body fluids as potentially harmful and contaminated. With this attitude, you can develop individual work practices to prevent exposures. The universal precautions concept is very valid and can greatly reduce the risk of exposures by treating all body fluids as contaminated with blood-borne pathogens. What are some of the things that emergency responders can do to reduce exposures? First of all, use gloves when working with blood or body fluids. Gloves can prevent the transmission of pathogens from the victim to the responder. In the event of a major injury where there is the possibility of exposure to the eyes or mucous membranes, a face mask and eye protection would be necessary. Minor injuries require minimal protection, such as gloves, but in other cases, a mask and eye protection would be required. That's what your company's exposure control plan is designed to do, and that specify what protection is needed for specific exposures. If you use sharps, such as needles, approved sharps containers are required. In an emergency situation where there's a lot going on, confusion, and frantically trying to save a person's life, a contaminated needle could expose you or someone else to needle stick and an exposure. Your organization must decide the best method of reducing these exposures and providing proper containers for sharps. Emergency responders must also consider the exposure to contaminated clothing and supplies, such as Band-Aids, gauze, linens, blankets, and other blood or body fluid contamination. In these cases, approved containers for contaminated clothing must be made available to prevent exposures to blood-borne pathogens. Never pick up any broken glassware or sharps with your hands. Use tongs or a broom and dustpan, but never your hands. One of the most serious methods of transmission of these diseases is through skin puncture with contaminated blood or blood products. Use extreme caution when handling sharps, and use proper containers for disposal of these sharps. Personal hygiene is more than taking a shower and washing your hands every day. It also includes prohibiting eating, smoking, drinking, or applying cosmetics in areas where blood-borne pathogens may be present. Regular hand washing, particularly with a germicidal or antibacterial soap, is mandatory immediately after removing gloves or other protective equipment after coming in contact with blood or body fluids. Gloves must be discarded and not washed or reused. In some situations, water may not be readily available. However, there are disposable germicidal wipes you can use in the field to use until you get to proper hand washing facilities. You must also keep any personal protective equipment clean, sanitized, properly stored, and free of contaminated products. While we're talking about cleaning and sanitizing, let's explain the difference. Cleaning with soap and water simply removes dirt, blood, and other residue from the surface you're cleaning. Sanitizing is the method of actually killing the bacteria on a surface, and this can be accomplished by sterilizing in an autoclave or by using a disinfectant. A good disinfectant, recommended by the U.S. Public Health Service and Centers for Disease Control, is to make a household bleach solution of 1/4 cup of bleach to 1 gallon of water solution. Commercial disinfectants are also available for sanitizing equipment and working surfaces. There is a big difference between cleaning and sanitizing. Sanitizing actually kills bacteria, where cleaning only removes the obvious residues from the surface. Emergency responders who are reasonably anticipated to become exposed to blood-borne pathogens can obtain vaccination from the hepatitis B virus at no cost to the employee. This vaccine is not mandatory, but it is available. If you're not sure whether you should be immunized against HBV, consult your physician or medical advisor about the vaccine. If you decline the vaccine, you must sign a declination form stating that you decline the vaccine. However, at any time, if you're still in a job that exposes you to blood-borne pathogens, you may choose to have the vaccine administered. There is no requirement for you to be pre-screened before taking the hepatitis B vaccine.
Hepatitis B is a little bit different because usually it's transmitted by blood products. It can also be transmitted sexually, and there are other ways, but the main thing to be careful there is contact with blood or blood products. In the case of hepatitis B, we're very lucky because there are vaccines which will allow us to give immunization to the patient in advance of exposure, and they can avoid the infection. One can have blood splash in the eye, one can have finger stick type injuries, you can have blood make contact with cuts in the skin. Probably more of the transmissions occur by transfusions or by use of contaminated needles or by sexual contact. Nevertheless, in a healthcare environment where you concentrate sick people, you're seeing a lot of sick people, a lot of potentially infected blood that you need to be careful about.
In the event of an exposure incident, such as a needle stick, contamination of the mouth, eye, mucous membrane, or other puncture of the skin, the first thing to do is wash the exposed area with water and then seek medical attention as quickly as possible. Fast action is the key to prevention. Always report any incident or potential exposure to your supervisor so medical attention can be provided. Post-exposure evaluation and follow-up programs will be made available to you should you become exposed to blood-borne pathogens. Medical records are confidential and only certain information may be provided to your employer. At no time will the results of any testing or other medical evaluation be reported to your employer. Your physician will discuss all pertinent medical evaluation and diagnosis with you, but will not reveal this information to your employer. Your rights to confidentiality are protected. Okay, some more tips to help reduce occupational exposures to blood-borne pathogens. Generally, sharps containers and regulated waste must be identified by color coding and with appropriate labels. Warning labels include the orange or orange-red biohazard symbol affixed to containers of regulated waste and other containers which are used to store or transport blood or other potentially infectious materials. Red bags or containers may be used with biohazard labels and signs. Do not place biohazards in infectious waste containers. Infectious waste is different from biohazards, although some infectious waste, if contaminated with blood or blood products, can be classified as a biohazard. There are other rules and procedures to reduce exposures to blood-borne pathogens, and these will be a part of your organization's ongoing training program and compliance with these new regulations. The most important part of prevention and controlling exposures is you. It takes an effort on your part to follow the rules, maintain good housekeeping and hygiene practices, watch for and eliminate potential hazards, and follow through with a good safety attitude. You and your attitude remain the most important part of reducing exposure to blood-borne pathogens. If you have any questions, ask your supervisor. If you have any questions about blood-borne pathogens, universal precautions, or any information relating to reducing exposures, they will be answered by a competent person who is knowledgeable about OSHA's new rules and other information discussed in this program. This information may be provided in person or by telephone communications with this competent person. Thank you.
The Blood-borne Pathogen Standard has many requirements and responsibilities that must be provided, such as a comprehensive exposure control program, needle stick injury prevention, personal protective equipment, medical records, record keeping, and much more. What we would like to do in this particular program is list the 14 elements of information and training that is required for your blood-borne pathogen program to meet OSHA standards. You might say this would be a great checklist to ensure that your program is up to date and is in compliance. Required information and training. This information is taken directly from OSHA standards relating to bloodborne pathogens, 1910.1030 G2. The first part of required information and training is employers shall ensure that all employees with occupational exposure participate in a training program, which must be provided at no cost to the employee and during working hours. If your job reasonably anticipates you being exposed to blood or other potentially infectious materials, or OPIM, this training would apply to you at the time of initial assignment to tasks where occupational exposures may take place. This means when you are first assigned these tasks, training must be provided. Training must be provided at least annually thereafter. Annual training for all employees shall be provided within 1 year of their previous training. Employers shall provide additional training when changes such as modification of tasks or procedures or institution of new tasks or procedures affect the employee's occupational exposure. The additional training may be limited to addressing the new exposures created. Material appropriate in content and vocabulary to educational level, literacy, and language of employees shall be used. Basically, this standard means the company must train at the educational level and literacy competence of the individuals and the language used by the employees. If Vietnamese is the language spoken by employees, then training must be in that language. 14 required elements. The training program shall contain, at a minimum, the following elements. Element 1. An accessible copy of the regulatory text of this standard and an explanation of its contents. Element 2. A general explanation of the epidemiology and symptoms of blood-borne diseases. Epidemiology is the study of factors affecting the health and illness of populations and symptoms of infection of blood-borne diseases. Element 3. An explanation of the modes of transmission of blood-borne pathogens, generally, how blood-borne pathogens are transmitted through exposure to these pathogens. Element 4. An explanation of the employer's exposure control plan and the means by which the employee can obtain a copy of the written plan. This is the employer's exposure control plan and where the employee can obtain a copy of the plan. Element 5. An explanation of the appropriate methods for recognizing tasks and other activities that may involve exposure to blood and other potentially infectious materials. Element 6. An explanation of the use and limitations of methods that will prevent or reduce exposure, including appropriate engineering controls, work practices, and personal protective equipment. Element 7. Information on the types, proper use, location, removal, handling, decontamination, and disposal of personal protective equipment. Element 8. An explanation of the basis for selection of personal protective equipment. This training explains why particular personal protective equipment is used and the purpose of wearing it. Element 9. Information on the hepatitis B vaccine, including information on its efficacy, safety, method of administration, the benefits of being vaccinated, and that the vaccine and vaccination will be offered free of charge. This type of training would cover these aspects of the hepatitis B vaccine and information for you to make a decision to take the vaccine or decline it. Element 10. Information on the appropriate actions to take and persons to contact in an emergency involving blood or other potentially infectious materials. This information helps you take proper action in the event you are exposed to blood or OPIM. Element 11. An explanation of the procedure to follow if an exposure incident occurs, including the method of reporting the incident and the medical follow-up that will be made available. Element 12. Information on the post-exposure evaluation and follow-up that the employer is required to provide for the employee following an exposure incident. Element 13. An explanation of the signs and labels and/or color coding required by paragraph G1. And Element 14. An opportunity for interactive questions and answers with the person conducting the training session. If the training is conducted online, there should be an opportunity for you to ask questions to a topic expert, generally via telephone or email. Other requirements. The person conducting the training shall be knowledgeable in the subject matter covered by the elements contained in the training program as it relates to the workplace that the training will address. The Bloodborne Pathogen standard is very comprehensive and requires compliance in all parts of the standard. Employees who may reasonably anticipate being exposed, such as first aid providers, emergency responders, hospital workers, and similarly employed persons, must be trained. Of course, all training must be properly documented. Documentation is a mandatory requirement on almost any training that is conducted in any organization.